Alzheimer's disease is an neurodegenerative disorder. Look at this picture, shows that neurodegeneration, neurons, CT findings and MRI findings. Detail going on. Introduction. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, thinking, behavior. It is the most common cause of dementia, especially in older adults. AD results in the gradual loss of cognitive abilities, leading to severe impairment in daily functioning and eventually death. The disease was first described by Dr. Alois Alzheimer in 1906 and has since been a major focus of neurological and geriatric research. Definition: Alzheimer's disease defined as a chronic neurodegenerative disease characterized by the accumulation of amyloid beta plaques and two tangles in the brain, leading to the degeneration of neurons. Especially in areas responsible for memory and cognitive functions, it is progressive, meaning it worsens over time, and there is currently no cure. Types: 1. Early onset Alzheimer's disease occurs before the age of 65, usually between 30 to 60 years. It is rare and often linked to genetic mutations. 2. Late onset Alzheimer's disease. The most common type occurring after the age of 65 with no clear genetic link. 3. Familial Alzheimer's disease, a rare inherited form of the disease, typically early onset, caused by genetic mutations. Example: PSEN1, PSEN2 and APP genes. Causes: the exact causes of Alzheimer's disease is not fully understood, but several factors contribute to its development. 1. Genetic mutations in the APP, PSEN1 and PSEN2 genes are linked to familial forms of the disease. 2. Amyloid beta blocks. Abnormal accumulation of amyloid beta protein in the brain forming plaques that disrupt neurological communication. 3. Tau tangles. Abnormal tau protein accumulates inside neurons, leading to their dysfunction and death. 4. Environmental and lifestyle factors. Poor diet, lack of exercise, smoking, and a sedentary lifestyle may increase the risk of AD. Risk factors. 1. Age. The most significant risk factor, with the majority of cases occurring after the age of 65. 2. Family history. Individuals with family history of Alzheimer's are at higher risk, particularly for early onset AD. 3. Genetic factors. The APOE4 gene variant is associated with an increased risk. 4. Lifestyle factors. Poor cardiovascular health, obesity, diabetes, smoking, and a sedentary lifestyle increase the risk. 5. Gender. Women are more likely to develop Alzheimer's, partly due to longer life expectancy. 6. Head trauma. A history of traumatic brain injury increases the risk of AD. Complications. 1. Cognitive decline, leading to difficulty in performing everyday tasks, problem solving, and decision making. 2. Behavioral changes. Aggression, depression, anxiety, and mood swing can develop. 3. Difficulty swallowing. In later stages, this can lead to malnutrition, aspiration, pneumonia, and choking. 4. Incontinence. As the disease progresses, individuals may lose bladder or bowel control. 5. Immobility. Loss of mobility due to muscle weakness can increase the risk of infections, bed sores, and blood clots. Pathophysiology. The two hallmark pathological features of Alzheimer's disease are: 1. Amyloid beta blocks. The abnormal accumulation of amyloid beta peptides between neurons form plaques that interfere with cell communication. 2. Neurofibrillary tangle, tau tangles. Abnormally phosphorylated tongue proteins accumulated inside neurons, disrupting the structure and function of microtubules, leading to neuronal death. The loss of synapse and neurons primarily occurs in the hippocampus and cerebral cortex areas responsible for memory, learning, and cognitive functions. This degeneration spreads over time, leading to global brain atrophy. The pathophysiology of Alzheimer's disease involves several processes that progressively damage and destroy neurons in the brain. Here is step by step breakdown of how these pathological events occur. 1. Amyloid beta plaque formation. Amyloid precursor protein, enzymatic cleavage, A beta aggregation. 2. Neuroinflammation and immunoresponse. Microglial activation, chronic inflammation. 3. Tau protein abnormalities and neurofibrillatory tangles, normal function of tau and hyperphosphorylation of tau. Neurofibrillatory tangles. 4. Synaptic dysfunction and neurological death, disruption of synaptic transmission, loss of neurons. 5. Progressive brain atrophy, cortical shrinkage, hippocampal atrophy, enlargement of ventricles. 6. Widespread cognitive and functional decline, memory impairment, behavioral and psychiatric changes, motor and functional decline. 7. Final stages, severe brain atrophy, complete dependence, the step-by-step degeneration process leads to the classic symptoms of Alzheimer's disease, starting with memory loss and culminating in severe disability. Signs and symptoms. 1. Memory loss, the most common early symptom affecting the ability to remember recent events or conversations. 2. Confusion about time and place, difficulty remembering dates or where they are. 3. Difficulty with family tasks, routine tasks like cooking or handling finances become harder. 4. Language problems, trouble finding the right words or following a conversation. 5. Personality changes, mood swing, apathy, depression and anxiety. 6. Disorientation, getting lost in familiar surroundings. 7. Poor judgment, making decisions that are out of character or unwise. 8. Difficulty with abstract thinking, challenges with planning or solving problems. 9. Physical changes in the later stages. Patients may lose the ability to walk, talk, or swallow. Diagnosis. Diagnosis is based on a combination of clinical evaluation and diagnostic test. One, medical history, review of symptoms and family history. 2, cognitive test such as the mini mental state examination and Montreal cognitive assessment to assess cognitive impairment. 3, neuroimaging, MRI, CT scan to detect brain atrophy and rule out other conditions. 4, biomarkers testing cerebrospinal fluid for amyloid beta at tau levels. 5, genetic test for early onset cases, testing for mutations in APP, PSEN1, PSEN2 and APOE E4 may be conducted. Nursing diagnosis. 1, impaired memory related to progressive decline in cognitive function. 2, impaired verbal communication related to language deficits and memory impairment. 3, risk for injury related to cognitive deficit and impaired mobility. 4, caregiver role strain due to the prolonged care required for the patient. 5, self-care deficit related to the loss of functional abilities. 6, impaired social interaction due to cognitive impairment and behavioral changes. Management. 1, cognitive therapy, activities that stimulate the mind and memory. 2, environmental modifications, adjusting the home environment to reduce confusion and enhance safety. 3, occupational therapy, to help patients maintain independency as long as possible. 4, caregiver support, education and respite care for caregivers are crucial. Treatment. Medications. 1, cholinesterase inhibitors help increase acetylcholine levels to improve memory. 2, NMDA receptor antagonists, example memantine, protect neurons from damage by regulating glutamate. 3, antidepressants for managing mood disorders like depression. 4, antipsychotics using cuteously to manage severe behavioral symptoms. Psychosocial medicine. 1, patient support, providing counseling and emotional support is crucial to manage anxiety, depression, isolation. 2, caregiver support, education, respite care and emotional support for caregivers are essential as they face emotional and physical burdens. 3, community and family involvement, social support from family and community services can improve the quality of life for both patients and caregivers. Prevention. While Alzheimer's disease cannot be entirely prevented, several lifestyle modifications can reduce the risk. 1. Healthy diet. The Mediterranean diet have been associated with better cognitive health. 2. Regular physical activity. Exercise supports cardiovascular health and may lower AD risk. 3. Mental stimulation. Engaging in cognitive activities like reading, puzzles, and learning new skills. For control of cardiovascular risk factors, managing hypertension, diabetes, and cholesterol levels. 5. Social engagement. Maintaining strong social connections helps promote cognitive resilience. In conclusion, Alzheimer's disease is a major public health issue, especially as the global population ages. It profoundly affects patients, families, and society. Although there is no cure, early diagnosis, proper management, and supportive care can significantly improve the quality of life for those affected. Ongoing research provides hope for future breakthroughs in treatment and prevention. Thank you. Have a nice day.